Welcome to the Pregnancy Help Podcast. I'm Christine Grimmett. We are coming to you again from Salt Lake City from our annual conference. And we were blessed today to hear a keynote by Dr. Kearney. And so we've brought him on the podcast to tell you a little bit more and give you a look into some of what was shared in that keynote. Lisa Bourne is also with me. She's the managing editor of Pregnancy Help News. And so, Lisa, I will turn things over to you.
Thank you so much, Christine. And as she said, we're here with Dr. Dermot Kearney from the UK, originally from Ireland. And he just came out of giving a keynote address here at Heartbeats Conference. And wow, did he just give us so much inspiration telling his story. And so I wanted to ask you, Doctor, to just start back at the beginning of that and go through that briefly for any of our listeners who may not be up on what has taken place in you offering APR over the last 3 or so years.
Thank you very much. Thank you very much, Lisa. I suppose I should start in case some of the listeners aren't quite fully aware of what happens in medical abortion or chemical abortion. So most abortions nowadays, and in the UK it's almost 90% of abortions take place by drugs rather than by surgery. A small number still are procured by surgical means, but 90% plus are done by chemical means. And that involves taking a tablet called mifepristone, which separates the developing fetus and placenta from the lining of the womb by inhibiting the action of progesterone. Progesterone, as the name suggests, it's progestation. It's a hormone that is essential for maintaining a pregnancy. And if either there are very low levels of progesterone, or if progesterone is prevented from having its natural effect, then there's a grave danger of losing the pregnancy and losing the baby. And that's what happens with the mifepristone. So it blocks, it's a specific antagonist where it blocks receptors for progesterone. So it gets in there before the natural progesterone can have its beneficial effect. And it has, mifepristone has the harmful effect of blocking progesterone. Then the mother is then meant to take mifepristone, a single tablet, and 1 or 2 days later is meant to follow up with a second drug called misoprostol, which causes contraction of the uterus. It's a prostaglandin, causes contractions and expels the baby and the other products, completing the abortion, or it's meant to complete the abortion, although it doesn't always result in a complete abortion. And if a mother takes both abortion pills, there's a greater than 98% chance that her baby will die, that the baby cannot survive. A small number do survive. The majority of those who survive are then subjected to a surgical abortion, unfortunately, but a small number are allowed to live, and their mothers appreciate that their baby has survived. So where APR comes in, there's a window of opportunity. If a mother takes the first abortion pill, mifepristone, and if, for whatever reason, she changes her mind, as many do, possibly up to 10%, but they don't always get to hear about the service that we offer. But if a mother changes her mind, despite having taken the mifepristone, as long as she doesn't take misoprostol, and if she can get progesterone promptly, ideally within 24 hours, but even up to 72 hours, there's a chance that progesterone can compete with the mifepristone and can prevent the action of mifepristone and can save her baby. So that's the rationale for abortion pill reversal. It's the progesterone that we use, which is a natural hormone present in all pregnancies. We're just supplementing the dose in the hope that we can prevent the action of the mifepristone and so save the baby. So that's what abortion pill reversal is. It's a progesterone, natural progesterone, to prevent the harmful effect of or potentially fatal effect. So if a mother takes the mifepristone and doesn't get progesterone, and if she doesn't take the misoprostol, there's about a less than 20% chance her baby will survive. If we can get progesterone, then there's a greater than 50% chance. So what we're doing is we're reducing a certain mortality from more than 80% down to less than 50%. Now, there are not many interventions in medicine that have such a high success rate of preventing certain death with certain survival. The only one I can think of is in my own area of cardiology, of defibrillation. If someone's in ventricular fibrillation and you defibrillate them, there's a good chance that you will at least save them, at least temporarily. But very few other interventions are as effective as abortion pill reversal in terms of preventing certain death.
So if you could talk about doing this in the UK, the landscape is different there than here in the US. Chemical abortion, 10-year jump start on us, head start on us. Yeah. Let's fast forward to there as far as you know, how you got started doing that and what it's like there and what you faced.
Yeah, so I first became aware of abortion pill reversal in 2014 when, as a member of the Catholic Medical Association, we were approached by a leader of one of the pro-life groups in the UK, called Jack Scarisbrick from Life organisation, who women were already coming to him because they had taken the first abortion pill, and they had heard somehow or other, because we didn't know anything about it, they had heard that it might be possible to still save your baby if you change your mind and if you don't take the second abortion pills. So he looked into this, and he saw that coming from the United States over the previous 2 years, from around 2012, that there was small numbers of cases being reported of successful outcomes where mothers had received emergency progesterone treatment. So he asked us, as he considered that we would probably be pro-life doctors, could we help in some way? So we decided, we'd look into it. Initially, myself and the other people involved, we were skeptical. We thought, is there really going to be a need for this? Is it going to work? And if it works, is there dangers that maybe the baby will have severe deformities? So there wasn't much information for those first couple of years. But as the years went by and we looked into it and more information became available, and then in 2018 we were asked again by another pro-life organisation called Good Counsel in London. Claire McCulloch, the director of that organisation, pleaded with us that they were having so many women coming to them and they could offer them nothing. But she knew it. She had read about case reports from the United States. So at that time I promised Claire that I would travel to the United States. I would meet the pioneers of the abortion pill reversal service, and I would try and by whatever means set up the service within the UK. And we did. It took a couple of years before we managed to get the service in operation. We initially had hoped that it would be a part of just the National Health Service, just part of national treatment, recognised by everybody. So we, as the Catholic Medical Association president, I wrote to the Royal College of Obstetricians, I wrote to NHS England, I wrote to the Royal College of General Practitioners, telling them about this wonderful new treatment, giving them the references to the data that we had obtained up to that point, hoping that they would say, this is great, let's get it on board, it's supporting women's choice. But we were met with very negative responses. Nobody wanted to get involved. Particularly, the Royal College was particularly hypocritical, and they said, no, we don't support off-license use of medications. I wrote back to them to remind them that misoprostol, the second drug used in abortion, is an off-license product. Even though it's used in abortion, it's not licensed for that purpose, but they were very happy to recommend it. I also mentioned methotrexate, which is used for inflammatory conditions, but is now routinely used as medical management of ectopic pregnancy. I pointed out to them that neither of those drugs, which they wholeheartedly recommend, are licensed for the uses that they recommend, so they're off-license, and I got no reply. We wrote back a third time and told them that we were disappointed that they hadn't responded to our second letter, but that we were now going to go ahead with offering this service to women. We were going to advertise it, and we presumed that they would have no objections to us doing so.
Do you think that might have painted a target on your back?
Possibly. They probably didn't take us seriously. We wrote to the GMC. The GMC gave a reasonable response, because our question was, if a doctor is approached by a woman who has changed her mind about abortion, what is that? How is that doctor supposed to act? And they wrote a reasonable response initially. This was 2019, the year before we actually started the service. And they said, well, we can't give specific clinical information. It's not within our remit to do so. But in our guidelines, we state clearly that every patient is entitled to know all of the treatment options available to them for any management decisions that are being made, and they're also entitled to withdraw their consent at any stage along the way of any management or treatment that has been proposed to them. So we thought, well, what we're offering satisfies both of those criteria. Right. So we said, let's try and do this somehow or other. So myself and another doctor, Dr. Riley and Riley, we took the first steps. We registered with Heartbeat International's Abortion Pill Reversal Network, just to inform them that if women from the UK somehow contacted the helpline service, that there were at least 2 doctors in the UK who could be contacted and would be able to offer that help to them.
Okay, so then it was 2020 that you began?
2020. Dr. Riley began in late May 2020. I got my first call in late June 2020. But the very first call I took, it was too late. The woman was already bleeding very heavily. And I expected we were going to get an occasional call, maybe once or twice a month. But within a matter of months, I was getting 6 a week, 6 requests for help. Now, not all of them were Not all of the mothers involved went ahead with the treatment. Some of them, for various reasons, decided not to go ahead with the treatment, but they wanted to discuss the option. Some of them, it was too late. They were already bleeding heavily. But roughly 2/3 of the mothers who contacted me, and the same with Dr. Riley, decided yes, they would like to try this. And we managed to get prescriptions for them so they could start the rescue treatment as soon as possible.
Would you like to give a quick rundown of overview of the numbers that you've had, or go into the persecution piece, whichever you would care to do first?
Well, before we were stopped from doing it, I had received 92 calls, the majority of whom were genuine. In retrospect, some of them were almost certainly undercover or investigative journalists who were just looking for information. It's now up to 137 since we were allowed to. I'm sure we'll talk a little bit about the investigation that took place. But once we were allowed to resume it, the numbers have dropped, and we'll come back to that, I'm sure, later on. But I've personally responded to 137 calls. There were others that I wasn't able to respond to because of, for example, I got one just before I came over here last week where I was just about to start a cardiology procedure, and I had to inform the nurse from APR. I can't do it for it'll be about an hour and a half, but if in the meantime you can contact my colleague, because we have one other doctor who's now prepared to, and I knew that he would be available. It was a Friday, and I knew that he doesn't have clinical commitments on a Friday. I said, if you're able to contact him, if he can't do it, just get back to me, and as soon as I've finished the procedure, I'll help out. But he was able to respond in that situation. So personally, I've responded to 137 calls, the vast majority from the Heartbeat line. Some of them have come directly from other pro-life organisations within the UK, and a small number of mothers have actually contacted me themselves. They've managed somehow or other to obtain my phone number or obtain my email address and have contacted me and asking, can I help them?
So that's since 2020, correct?
Since late June 2020.
But you were you were halted from doing it, so that there's a year.
Yeah, there was almost a year, and it took a little while to get it going again. So we were stopped doing it on the 28th of April 2021, and I was allowed officially to start doing it again after the 18th of February late February 2022.
Right.
But it took a little while to get the word out there that yes, we were now allowed to. We had to wait for official confirmation. So my next case after that was actually on St. Patrick's Day, 17th of March 2022, when I was contacted to help a woman who had taken the first pill, and then she went on to have her baby.
So yeah, we'll get to the suppression there in a little bit, but those numbers are over that period of time, with that period of time where you were not allowed to offer it.
And there were in that period of time, because I asked Heartbeat International, I asked Krista Brown to keep me informed of how many women from the UK were approaching the helpline or requesting help on the helpline from the UK month by month. And there were over 100 women. Now again, some of them may have been fake requests. There may have been people trying to see were we still doing the service when we were told not to. Some of them may have been maybe in two minds whether they wanted, but there was over 100 requests, and I was very happy to, because in the meantime when I was stopped doing it, I informed the GMC. I've told them the exact numbers, and I said, as a result of your decision, at least 25 to 30 babies are now dead that would have survived. So I wanted to let them know what they had done. They didn't really care too much, or at least they didn't express any opinion one way or the other.
So of the calls, run down the stats of the calls that you've gotten and the women that you were able to serve, and give a brief overview of that if you would. Yeah,
so of the 137, roughly 2/3, so about 64% I think, actually decided to go ahead with treatment. A small number, having started treatment, decided not to continue with treatment. We'd at least I had one case of an ectopic pregnancy, which is important because most of the requests we get are from women who receive the abortion pills without any prior ultrasound, because most of them get it through by what they call pills by post after a simple telephone conversation. So they don't get any ultrasound scans. So at least when we start APR, we always try to ensure that the mother obtains an ultrasound as soon as possible. Now, during COVID, that was difficult, especially on the NHS, where there are rules and regulations that, you can only get a scan at 12 weeks or at 20 weeks. And so sometimes we had to arrange for private scans. But in this case of the lady with the ectopic pregnancy, as a result of our intervention, we were able to at least determine that her pregnancy was not within the uterus. So it meant that she could get appropriate care, whereas otherwise she may not have done so. And we know that there have been some deaths, and there have been near-death experiences of women where it was presumed they were just having their planned abortion, but they actually had a severe bleeding and severe pain as a result of ectopic pregnancy. So getting back to the numbers, we've had in my own personal experience, and I think it's the same for I'm pretty certain it was the same for Dr. Riley and for the other colleague who is currently doing it, is we've a 50% success rate. That, if you take in context, that doesn't sound a lot. You say, well, 50% success, 50% failure. So I've had 28 babies that have been born. I've got 4 more who are well on the way. They're well past the danger period, if you like, of having taken the progesterone treatment for several weeks and within a safe zone now. So there's a good chance at 32. But I've also lost 32 that I'm aware of. There have been others that were lost to follow up. Some of them were lost quite early on, and I don't know, they may have gone ahead with the abortion, they may have suffered a miscarriage, or they may have gone ahead to keep their babies but just wanted this to be an episode in their life that they didn't want to be reminded of. So I genuinely don't know the outcome in some of those ladies, but others we know that were well past 15, 16, even one very unfortunate case past 18 weeks when she went ahead with an abortion under pressure from family members. So the numbers have been lost to follow up, but the overall success rate is 50 to 55%. The US experience, or at least in the data that's been published, they talk about 64 to 68% success rate. We're a little bit down on that, and there are probably a number of reasons. Number one is the timing. The sooner you can get progesterone and to administer it, the better. And there's always going to be a delay. Our mean time from the mother taking the mifepristone to actually starting the progesterone is around 25 hours, just over 24 hours. Whereas in some parts of the US, it's much, much shorter, 6 hours, 12 hours. We have had some cases where it's been less than 6 hours, but the majority are over 24 hours. And the second thing is that we don't have the luxury of getting ultrasound scans. So all of our consultations are done over the phone. We arrange the pharmacy prescription initially by a telephone call. And fortunately, 99% of the pharmacies are happy to take an initial email prescription. So we send them an email with the promise that we will then send the signed hard copy the next day or the same day if possible, and they'll receive it within 48 hours. But we don't have time. We don't have situations where the mother can just walk into an ER or into a pregnancy centre and say, "Oh, I've taken mifepristone, can I get a scan?" We don't have the opportunity to scan people. We try to arrange scans through the local early pregnancy units or privately if necessary within a matter of days. So we're starting treatment not knowing whether or not the baby is still alive. And whereas in the United States, in many places, they have that luxury of checking the viability. If there's no heartbeat or the baby's already demised, then they're not going to start treatment. So their success rates are going to be that little bit higher, I presume, whereas ours are always going to be, we have that disadvantage of not knowing until several days later whether or not the baby's actually survived. But overall, we've a slightly greater than 50% success rate, whereas compared to less than 20% of the babies surviving without progesterone is a significant improvement in survival.
So tell me it again. It was 28 confirmed?
In my experience, for mothers that I've held, 28 babies have already been born. 4 more are well on the way, and I'm hoping that I will continue to offer this service and that many more babies will be born and many more requests will come in for help. Although I would prefer if there was no such thing as a medical abortion, but I'm realistic to know that it's not going to suddenly go away overnight.
Right. So let's talk about what.
I can just add within the UK, 61 babies have been born. So it's not only me, as I mentioned, Dr. Riley in her case. So in our first year, 32 babies were born within the first. Well, at least had success. Some of them were born obviously after that period because it takes 9 months of pregnancy before the baby's born. But we had 32 before we were stopped from doing it, and since then, myself and my other colleague. We're up to 61 babies who've been born. Now, one of them was interesting. One of them was actually rescued by another obstetrician who's not part of the APRN network, but when a young woman, a teenage mother, was presented to him that she was being coerced. She'd already taken the first abortion pill, and she was being coerced by her parents to have the abortion. And he, knowing he was an obstetrician, he knew that the treatment of threatened miscarriage is progesterone. So he gave her, we know that because he's I won't mention where he works, but it came. Dr. Riley became aware. It was reported to her, and that child survived. The baby survived, and the mother was very happy to continue. So we know that at least one other person outside of those who are committed to this service has actually successfully reversed mifepristone by using progesterone. Just logically, he knew that this is what you do if there's a threatened miscarriage, and he was happy to do it in this situation which he regarded as coercion.
We have a saying here, and you've probably heard it from Krista, it's just progesterone. It's
progesterone.
that simple. Yeah. It's that simple.
But my wife says that all the time. She says, why? My wife, whenever she reads articles in the newspapers or in the media that people are objecting to, she says, but why? It's just progesterone. And she's not medical, she's not nursing, but even the layperson knows that this is what you do.
Absolutely. So let's talk a little bit about why you've become famous, if you will. You took a stand for life when a lot of people might not have done that. You risked a lot. So if you could, let's revisit, and again, just briefly for listeners who might not be familiar, what you experienced in trying to provide this service, life-saving service to women.
It was by accident. There was no intention to become famous by doing this. Myself and Dr. Riley were quietly offering this service. We did try to advertise it. For example, I spoke in March 2021, so just over 4 weeks before the accusations were laid against us. I spoke to a parliamentary committee in our parliament that were having a discussion on pills by post, and I was asked by Christian Concern, would I also say just a few words about the service that we were providing to women. And there was politicians, like members of parliament, were very interested, and they asked questions about it, and they said this was a wonderful thing to be doing. So I thought, this is great. And ironically, I was, as president of the Catholic Medical Association, I was invited by the GMC to sit on their Equality, Diversity and Inclusion Forum. And we had meetings every few months, including during COVID, sometimes by Zoom, sometimes in real person. And each meeting each organisation had to give just a brief summary of activities that they had been involved in. And in early April, so 3 weeks before the accusations from the GMC came, I told the GMC that, oh yes, some of our members, I didn't say how many or who they were, are offering women with crisis pregnancies who regret that they've taken the first abortion pill. They're offering them progesterone, and so far so many babies have been saved and so many are on the way, and the treatment success rate has been 50% or whatever at the time. And they said, thank you very much, Dr. Kearney, that's very interesting. Now we'll move on to the next group. And so we thought there was absolutely nothing wrong. We didn't realise that in the meantime, from January of that year, so this was April, from January that complaints had been going through the GMC, and they were discussing these things and drawing up their case against us.
But complaints from whom?
Complaints from the Royal College of Obstetricians.
Yeah, no women.
And from Mary Stopes International, the second largest abortion provider, and particularly their medical director, who has taken a particularly dislike to myself and Dr. Riley. The one, and unfortunately these complaints were endorsed by the GMC. So GMC accepted that these, even though there was absolutely no evidence to support the complaints. For example, and it's hard to believe that the Royal College would actually put in writing what they did. The legal advisor to the president of the Royal College wrote to the GMC to say, we're not so much concerned about the treatment that these doctors are offering, it's the people concerned. This service has fallen into the hands of right-wing Christian groups. One of them, myself, is the current president of the Catholic Medical Association, and the second, they referred to Dr. Riley, and she had spoken on some pro-life discussions about this issue. So they were basically saying that, and she's a Catholic, a member of the Catholic Medical Association as well. So they were trying to say that this treatment was bad or was wrong because it was being provided by Catholics, and Catholics could not be trusted to provide authentic, non-judgmental care to vulnerable women.
Wow.
Even though we had asked them 2 years beforehand, would you be prepared to support or to... We were happy to hand it over to them. We didn't want to have any monopoly on this. We just wanted to do what women wanted, was to serve them. So the accusation was against us was basically because we were Catholics. And then the other complaints included things like that I was acting outside my area of expertise as a cardiologist, but when they provide abortion, they're doing so on the grounds that women's mental health are going to suffer. So none of the abortionists have any training in mental health evaluation, and yet they're doing it. They claim that we were using an unlicensed medication, which is not true. Progesterone is licensed. We were using it off license, but as I pointed out, they use off licensed medications, as many doctors legitimately can do, for since time began, or since regulations began.
Yes.
And then there was other things that we were trying to enforce our pro-life beliefs, our religious beliefs on these vulnerable women, and there was absolutely no evidence of that.
Did someone not go to one of the women you treated and try to get her to say that you mistreated her? Yeah,
well, one of the women, and she's been very supportive. She's lovely, and I still keep in contact with her. She contacted me, and I prescribed progesterone for her, but if she didn't take the progesterone, she went back to Mary Stopes to say, I've been talking to this doctor and he's given me progesterone prescription, and they told her, don't take it, that's dangerous. So she didn't take it, and she went ahead with the abortion, but she had an incomplete abortion, and she suffered she suffered sepsis, and she went to Mary Stopes and said, I'm bleeding heavily, I've fevers, I'm in a lot of pain, and said, oh no, Gus, you have to go to your family doctor. So she went to her family doctor, and her doctor said, no, you have to go back to Mary Stopes. They gave you this treatment. They're the ones who have to deal with it. And so she's been over and back. So she came back, because I had been very nice to her. I'd been very understanding, very compassionate. So she came back to me in desperation. She said, I've been to Mary Stopes, I've been to my doctor. None of them can tell me what to do. I'm bleeding, I'm in pain, I'm shivering. I said, you're suffering an infection. You've probably got an incomplete abortion. You're going to have to go to your local ER department, a casualty department in the UK, and explain the situation to them. And you're going to need antibiotics, and you might need another intervention to complete the abortion. So she went to her ER, and they unbelievably gave her paracetamol and told her to go away. So she rang me again. I said, no, you've got to go back. And I even told her what antibiotic to ask for, because she was allergic to penicillin. I had to tell her the specific antibiotic. And so she went back, and eventually she was taken in, and she had a scan done, and they saw that there was infected material. She had to have an evacuation procedure and antibiotics. Well, she made a very good recovery. So Mary Stopes tried to convince her that my intervention had caused all these problems for her, even though she hadn't even taken the progesterone, and she had suffered this bleeding, within the time period that she would have taken within 24 or 36 hours. So it wouldn't even have been time for her to take the misoprostol by that stage, but she was starting to miscarry very, very early on. So they tried to say that, and we have a copy of the letter, because the medical director of Mary Stopes, first of all, he rang her. I don't know how he got her telephone number because she had to provide a telephone number for the abortion in the first place. So he rang her, and she didn't know who he was, and she didn't trust him, so she blocked him. She put down the phone and blocked him. And she told me that this doctor from Mary Stopes has been trying to contact. And I had no idea at this stage there was accusation against us. And I said, he's probably he's a bit worried that you're going to report his organisation because of these complications, and he's trying to get you before you. So that was my naivety. I thought that. But then he sent her an email, so we had her email address, and in the email he said that many other women have come forward and reported this doctor, me, because he knew he had my name at this stage, and we're trying to support women, and we have to report this to the GMC, and I thought that's a bit strange, because no other women have that I know of, and I'm now certain that no women had complained to either to his organisation or to the GMC or to anybody else, because that was the investigation had to take place, and they came to the conclusion that there was no evidence of any complaints from anybody. So he tried to basically make a woman. First of all, he harassed her, and she resented that, and she has reported into the GMC, but they've decided in their wisdom not to investigate him for whatever reason. We have reported them to the GMC for that and for other issues as well, for basically telling blatant lies to the media and on television and so on. But they have decided that, there's no case for him to answer. So these people are protected by powerful bodies, unfortunately. But, Christian Concern are not going to give up. They're going to not let this lie down.
So, for our listeners, who is Christian Concern? I know they represented you. I don't think we got to that part yet as far as walking back through where there had been some complaints, and then you were told, run through the timeline there. You were told to stop prescribing progesterone and threatened with losing your license, were you not? Yeah,
so we got the email from the GMC on the 28th of April 2021, and we were told that we had to attend a tribunal, that our case had been referred to the Medical Practitioners Tribunal Service, the MPTS, which is sort of a branch of the GMC, although they say they're independent. And our tribunal had been set for the 12th of May, so less than 2 weeks later. So it didn't give us a lot of time to get involved. That was a Wednesday. We received that at lunchtime on a Wednesday. I had to then inform the various pro-life organisations, including Heartbeat International, that unfortunately we were being accused of professional misconduct, so that we were no longer in a position to accept calls for help. Because at that stage we were getting several a week, and that could come at any moment of the day or night. So I had to tell them. So one of the groups I had to inform was Christian Concern, who had been very interested in what I'd been doing. They had, in fact, I mentioned the parliamentary committee. They had the ones who had organised that parliamentary committee meeting to take place, and were very involved with it, because they were very much concerned with the abortion pills by post and at-home abortions. So I had some involvement with them, but I didn't know them very well. But that was Wednesday. By Friday morning, Andrea Williams, the CEO of Christian Concern, had organised a Zoom meeting with myself, Dr. Riley, and two of her leading barristers, legal people. And we had a Zoom meeting, and my feeling was, well, there's nothing we can do. It's the GMC. You can't do anything against it. You have to just accept what comes. And Andrea Williams pointed her finger down the camera and said, "No, this is unjust. We are not going to allow this to happen. We're going to fight this, and we're going to win." And she got our legal team. So Mike Phillips, who was one of her top lawyers, over the weekend he contacted a person he knows, a medical expert he's probably used on other occasions in other cases, who's an obstetrician, a fellow of the Royal College of Physicians, so high-ranking and recognised person within that organisation, who does abortions. He's not a Christian, not a Catholic, so there was no conflict of interest. And we sent him the allegations, and I had, at that stage, they asked me to write my responses to them, so I sent my responses and the allegations to him. He looked over them, and by Wednesday, so within a matter of days, we had an expert witness on our side who said, "No, this is ridiculous." And he went through each of the allegations as I did, and he said, "No, there's no case to be answered here. We need to fight this, and we need to win." And then after that, we got statements from a number of the women. I wasn't allowed to be involved. I had to ask the women, is it okay if my legal team, I had to explain to them what was happening. Is it okay if my legal team contact you? And I could have got 40 responses at least, but we decided we got 10. We got 10 very good. We got some women who'd already had their babies, some women who were still pregnant and waiting to have their babies, some women who had tried the treatment but it didn't work, but were so grateful that somebody had tried to help them. And we even got 2 women who didn't take the treatment, who had discussed it with me, and they were very grateful for the opportunity to discuss the option, but decided for whatever reason not to go ahead. So we got 10 very strong supportive statements, which were discussions between a remarkable barrister who works with Christian Legal Centre, and she had very sensitive interviews with all of these women. Among the questions she asked them was things like, "Do you know what religion Dr. Kearney is?" And all of them, they said, no, that never came into the conversation. So, because I was being accused of forcing my religious. One girl did ask me on one occasion, after she'd started the treatment, a few days later, because I always contacted them to check that they were okay. She said, "Can I mind if I ask you something personal?" I said, "Yeah, sure, go ahead. Are you Catholic? Because my dad is a Catholic, and I thought you might be as well." That's the only time religion ever came into any of the conversation. So I didn't tell them what I was doing, or didn't say that they were going to go to hell if they didn't do this. So there was no question of any. And they asked, did Dr. Kearney put under any pressure? I said, no, it was my decision. I was the one who approached him, or through the organisation that led me to him. So they were able to refute all of the allegations that referred to pressure being put on the women, or bribery, or things like that. So they were able. So we got really strong supportive statements from a number of the women, and could have gotten many more if we needed them. But Mike Phillips felt, 10 that's a good number. That's enough. We don't want to overload the courts with too much information, because there was no evidence coming from the other side. So all the evidence so far was on our side. Then we appealed to the tribunal to say, we have this new information. We submitted it, and they allowed us to have an earlier hearing than had been planned. By law, they have to have a hearing every 6 months. So we were suspended. So we got to the hearing on the 12th of May, and we had this information. And to our dissatisfaction, our dismay, the tribunal were not interested in evidence at all. They said, no, we're not here to look at the evidence. We're here to look at the accusations, the allegations, to see, are they significant enough that we need to impose a penalty to allow an investigation to take place. and which they did. So they upheld the complaint without looking at any evidence or without seeking any evidence.
Wow.
And they said that Dr. Kearney must not, and that's the word must. When the GMC says must, then he must not. He must not prescribe, administer, or recommend progesterone for abortion pill reversal. I was also ordered that I must not participate in any voluntary activity, charitable activity, or private activities as a doctor without explicit written permission from the GMC to do so. So they were just covering all angles to make sure that I didn't perform this service. Dr. Riley was slightly different. She was she's an obstetrician, so they couldn't stop her from prescribing progesterone, although she wasn't allowed to prescribe it for abortion reversal. But she was even more harshly treated. They said that everything she does in her clinical practice must be done under supervision by a supervisor appointed by the GMC. Now, for a woman or a doctor of that experience that she had, that was almost humiliating that she would be put under this sort of scrutiny. But again, to make sure that she didn't prescribe this treatment to women, and she had to have weekly meetings with her supervisor to discuss what she'd done. So it was awful, the penalties that they imposed, and without looking at any evidence or lack of evidence, as it turned out. So having got this evidence, we then sent it to the tribunal, thinking that, surely they're going to look at the evidence. So we were granted an earlier hearing than had been planned. So hearing was planned at 6 months. So this was May, the 12th of May. Hearing was planned for sometime October or something. And but we got an earlier hearing. But again, almost unbelievably, at the very beginning of the meeting, the chairperson said, "Of course, this is not a tribunal to determine the veracity of the facts or the factual nature of. We're here to look at the allegations. No evidence will be considered at this stage." So at that stage, my legal team just threw up their hands in exasperation and said, "This is ridiculous." So we're going to apply to the High Court, like to take it out of the hands of the GMC. So that's what they did. So they submitted a suit. So we sued the GMC, submitting to the High Court in early October 2021. And I was very surprised, because I thought with the backlog of COVID there was lots of cases not being heard, and I thought it's going to take maybe 2 years, 3 years. But we were surprised that we were told that we were granted a hearing on the 24th of February 2022. So within a matter of months we got all our cases together. In the meantime, the GMC wrote to us a few times to say that we're having difficulty obtaining an expert witness to support our case. And we thought, well, we got home within 3 days. Right. Where's the problem if you're so confident? But anyway, they eventually got one in January 2020. At this stage, they knew they were going to court in February, so they hurriedly, or whatever it means, they managed to get an expert witness. And another fellow of the Royal College of Obstetricians who does abortions and certainly had no conflict of interest. But his report was surprisingly very, very supportive, almost identical to the report that came from our expert witness. His only concern was that one of the issues was that I was, in some cases, helping the women to pay for their treatment if they couldn't afford it. Now, that was always my last question. I always had to say to them, by the way, this is not a normal NHS prescription, so a National Health Service prescription. So unfortunately, it has to be paid for. And the next obvious question is, how much is it going to cost? And it's not too expensive, but for the first 2 weeks of treatment, because I usually got 2 weeks at a time, it'll be about £20. That'll be about $25, $26. And most of the girls would say, that's fine, that's no problem, I can do that, because they wanted to save their babies. But a small number said, I'm afraid I can't. So I said, so is the only reason that you don't want this treatment, or that you're not going to go ahead with the treatment, is the only reason financial? Because if it is, I am very happy to help out. Now, initially, the first time I did that, I thought I could just pay the pharmacist, and but the pharmacy wouldn't accept that. There's some regulations. So I had to put the money into the mother's account, and then she would then pay the pharmacist. So we were able to demonstrate that we weren't bribing these women to do what we wanted. We were paying for the service. We were offering, first of all, a free service ourselves, and there's nothing wrong. There's no rule that says a doctor can't give free service or act in a charitable manner. I was stopped from doing so by the GMC. So we were able to show that we weren't actually paying the mother, we were paying the pharmacy, but it had to go through her. There was no other way to do it. And that was accepted. And so he gave his expert witness report, and then we were meant to go to court on the 24th of February, and 6 days beforehand, on the 18th of February, I received a phone call from Mike Phillips, my solicitor, my barrister, to say, had I heard the news, the wonderful news, that the charges have been, and I hadn't heard, but he said the charges have been dropped. And I was stunned. But then half an hour later, I got a confirmatory email from the GMC to say that they'd looked into it, and their case investigators had come to the conclusion, and they sent me a full report of which was quite a detailed report of everything. The case investigators' conclusion was there was no prospect of finding any evidence to support the allegations and to support the charge of professional misconduct. So they had no option, but they had to wait a couple of days because it then had to go back to the tribunal, who then had to officially withdraw the.
So it wasn't heard in the High Court, correct?
We never got our day in court.
You stared him down.
They would have had to go to the court, and I don't know.
Them withdraw.
If you've ever been to a court, the evidence is an important part of a court process. So if the judge would have turned to the GMC's barrister and would have said, "Okay, can you present your evidence to support this case?" And he would have had, all he would have been able to say was, "Well, we don't have any evidence, Your Honour, but we don't like what that guy's doing."
We're focused on the allegations.
That's all they would have had. They just didn't like what we were doing, but without any evidence to support the draconian measure, if you like, that they had imposed upon us.
So they were hoping to stop you with intimidation then.
Oh yeah, the whole process is part of the persecution. Interestingly, Dr. Riley, she didn't go with Christian Concern. I was supported wonderfully by Christian Concern, who said we're going to fight this. She went with a secular group who told her,
be more low-key.
Don't fight this. Keep your head down. Don't make it any worse. We know you're guilty, but let's just aim for damage limitation here. So she didn't challenge it. So I was the only one who took the GMC to court. And interestingly, the charges against her were not dropped until 2 months later, because the GMC had nothing to worry about. They weren't going to court with Dr. Riley. They were only going with me. But on the other hand, they couldn't maintain those the penalty that they imposed upon her, seen as it was more or less the same thing that we had been doing. So when they had to withdraw the charges against me, then just by sheer logic, they had to, and justice, they had to withdraw the charges against her. But it took them 2 months to do so. It was the end of April when eventually she was allowed to resume the APR service.
So your license was at risk, however.
The GMC wanted it. Their demand at the first tribunal was, we want these two doctors to be suspended for 18 months. That means we wouldn't be allowed to do any medical practice whatsoever. And that would be reviewed by law. That had to be reviewed every 6 months. So the 18 months would have gone by, 6 months they would have reviewed it, or at 18 months, and then they would have imposed another 6 months and another 6 months, because they didn't want to take the chance that we would, start this practice again, because I don't know whether they get financial rewards from the people that they serve or whatever, but for whatever reason, ideological or some other reward system, they just didn't want us to do this.
So, and I know that this wasn't just you going through this. Your family went through it with you. And I think I asked you maybe 2 years ago when we first talked about this, like what was in your mind as far as what was at risk there? And you had a very simple answer for me, if I remember correctly. I mean, it was something about doing, they didn't have any evidence and I was doing the right thing, something to that effect. And it was just so simple what you said at that time. Yeah,
I wasn't particularly worried. I should have been worried because, and I had to go, like the hospital I work in, we have a medical director who's in charge of all the medical doctors in the practice. And I had to go and meet him on a number of occasions, every few weeks. Now, I didn't necessarily realize initially why that was, but it was for my welfare, because doctors have committed suicide who are under investigation by the GMC. And every time I went to the meeting, I would walk in the door. Now, he's an obstetrician. He does abortions, or he used to do abortions. I'm not sure if he still does. But he admitted to me on the very first time, I know nothing about this. I know a little bit about the issue, but I know nothing about it, so I don't have an opinion one way or another. So he was showing that he wasn't either opposed to me or in favour of me, but he was there for my welfare. And I'd go in and he'd look at me and he'd say, "Are you okay?" And I'd smile and say, "Oh yeah, I'm fine." And then he'd look at me again, Are you sure you're okay?" I think he was surprised that I wasn't trembling or crying or falling to pieces, that I was just treating it as just a casual meeting with a friend. And we'd sit down and we'd have a little discussion, and I'd go out and then we'd arrange another meeting in another few weeks, and I'd go back. And the same thing happened. But I'll probably say to you, because I was asked that question once on the very first interview I did on this issue was with a wonderful guy in Pennsylvania called Travis Rusko. Travis runs a podcast, probably a bit like your service here, and he'd heard about my story, and it was him actually who put me in touch with Christina Francis and Donna Harrison at Applog, because I knew nothing. I never heard of Applog. I knew nothing about them, and he was the one who connected us. And then they invited me to tell my story. So he was the first person that I spoke to about it. But I did tell him there are some things I won't be allowed to say because there's an ongoing case. There will be some restrictions, but I'm happy to tell the things that I'm allowed to say. And at the end of it, after about an hour, he said, Dr. Kearney, I'm sure some of our listeners would be very interested to know, did your Christian faith support you, or how did your Christian faith impact upon you during this period, during these troubled times? And it immediately struck me that I'd read a little bit before about an actress in Hollywood called Patricia Heaton. She's on a show called Everyone Loves Raymond. I've never seen it, I have to admit. I don't even know what Patricia Heaton, what she does, but she's presumably a good actress. But she is one of the very few outspoken pro-life and religious persons in Hollywood who's happy to stand up for her faith and for her pro-life values, even though all around her are not. Right. And she was asked that question, how do you cope with everybody in Hollywood being not supporting what you support? And she said, well, at the end of the day, come Judgment Day, it's not Barbara Streisand I'll have to stand before at the time of my judgment. And I quoted that to him, and I said, and come Judgment Day, it's not the GMC or the NHS that I'm going to have to stand before. And he loved it, and his audience loved it, and there was some nice replies and comments on it. But that's the truth. We knew we were doing it. If I'd been doing something wrong, then yes, I would have felt really bad about it and very upset about it. But because I knew what we were doing was good, I wasn't particularly upset. I said, if they sack me, if I lose my license, well, I did so by doing the right thing. And now my wife wasn't too happy about that. She was already making plans about, we're going to have to sell our house and get a much smaller house and move away from the area. And but that didn't strike me that was going to be necessary. Now I can only put that down to prayer, because I know through Christian Concern, through the Catholic Medical Association, through people, Pregnancy Health News and other news outlets, Christian and pro-life outlets, who came across the story and reported, we got so much prayer from around the world, and people writing to me and sending me messages that we're praying for you. And I can only put it down to the prayer that I received from so many people from all over the world that I wasn't as upset as I should have been. I probably should have been very worried, but to me it was just another day in the life.
Wow. So you inspired our conference attendees today with your keynote. You ran through all of this. You showed pictures of a few of the babies that you've been able to save, and of course that just brings it home. Share, if you will, what bottom line, what the message was that you brought to the folks that you spoke to at the Heartbeat Conference today.
Well, the message was, first of all, we need to continue to provide the service. We need to create greater awareness. I know there are 1,200, 1,400 providers in the US who are participating in abortion pill reversal, but some aren't, and some are afraid to do so because there is a tax already in a number of states, particularly Colorado, California, Vermont, maybe New York, possibly others waiting in the wings to see can they jump in on the action. So there is a fear out there among medical directors of pregnancy centres, doctors who are pro-life but are just a little bit concerned, if I get involved with this, will I lose my licence, will I attract bad publicity and so on. So I wanted to send a message to them that you will be attacked, there will be opposition, but you're doing the right thing, and never give up doing the right thing. And with prayer, with perseverance, with good legal support, being honest, being articulate, being intelligent, being charitable, we can overcome this. We can still provide, because women need the service. Like, we're doing it for the women. If it wasn't for the mothers requested the service, then I certainly wouldn't be involved. We're not trying to impose a service upon women. They're coming to us. They need the service. They want the service. They need to be, more of them need to be made aware that this service is available. Because in the UK, we know, and it's probably the same in many places here, we know that women are being actively told when they receive the abortion pill, mainly by telephone conversations, they're being told, if you change your mind, do not seek abortion reversal. They're actually being told that, and we know that because women who do come to us, the courageous ones who do eventually come to us, they tell us, I was told I shouldn't contact you, but I really want to save my baby. So I looked it up and I had to scroll down, but I eventually came across Heartbeat International or some life organization, pro-life organization. So we know that there is a lot of opposition, but don't give up. It's such an important service. Women need this. and we have to be there for them.
So raising awareness about APR, getting more providers, and you just touched on it here too, but I think you had said something about don't ever get tired by doing the right thing. You were suppressed from saving lives as a doctor for a period of time.
Yeah.
And your license threatened, and the attacks will come, like you said, but you kind of brought it home with trying to give people encouragement in there, even APR related or not. Don't shy away or don't get too tired of doing the right thing.
Yeah, never get tired. I anytime I give a talk, regardless of what the topic is, I try to. I quoted a Roman senator who, at the end of every speech in the Senate, at the end, rather regardless of what the topic was, he finished all of his speeches with "Carthage must be destroyed, Carthago delenda est." Because he was so passionate about preserving the supremacy of Rome. So I finish all of my presentations, if I can, with don't get tired of doing what's right. That's it. I think it's a direct quote from one of the St. Paul's letters as well. Never give up, never tire of doing the right thing. I can't remember the exact word for word quotation, but it was on one of the recent readings from one of the masses I attended. That's the message of the epistles of St. Paul. So it's the message of the gospel. Don't give up. Keep doing what's right. Come what may. There will be opposition. Remember, they hated me first. They'll hate you, but they hated me first. That's a direct word from our Lord himself, I think. So we keep going. We try to do what's right, knowing we know what the outcome is. We know what the final outcome is. So while we may not all be around to see the day of triumph, but we know that eventually victory will come. We know what the final outcome is going to be, regardless of what hardships and persecutions we may have to face in the meantime.
There's no better place to leave it than there. Dr. Dermot Kearney, thank you so much for joining us today. I am Lisa Bourne on the Pregnancy Help Podcast. We're going to give it over to Christine.
Thanks, Lisa. Thanks, Dr. Kearney. I will add a link in the show notes to Dr. Kearney's keynote so that listeners can enjoy that full keynote address, and subscribe to the podcast to stay updated on what's happening in the pregnancy help movement. And thanks for listening to this episode of the Pregnancy Help Podcast.